Diabetes mellitus is a chronic disease occurring from faults in a body's glucose-insulin pathway. There are three main types of diabetes: type 1, also known as juvenile diabetes, type 2, or adult onset diabetes, and gestational diabetes. A growing global crisis, type 2 diabetes was estimated to affect nearly 500 million people in the world in 2017, with over 90% of those cases type 2 diabetes. Today, more than 1 million Australians live with type 2 diabetes. That's 1 in 14 adults, or 4 members of the ICM class, being diagnosed in our lifetimes. For adults in low socioeconomic regions, the prevalence rate increases from 5% to 8%. For Aboriginal and Torres Strait Islander Australians, this rate increases to around 18%, equating to at least 6 ICM students being diagnosed if we were all Indigenous. This graph portrays the percentage of Australian adults with type 2 diabetes increasing sharply with age, with most diagnoses occurring over 55 years. Although it is a widespread condition, the exact etiology of type 2 diabetes is not fully understood. Current research identifies a range of factors which increase one's risk of developing insulin resistance, and from that, type 2 diabetes. One major risk factor is genetics. In 2014, a study suggested that individuals with type 2 diabetics as parents have a 40% increased risk of developing the condition themselves. Other risk factors include obesity, as central adiposity increases the risk of insulin resistance, age, family history of diabetes, level of physical activity, diet, and childhood nutritional intake, as well as socioeconomic status and ethnicity. It is theorized that interactions between these factors provide an explanation for type 2 diabetes risk. The pathophysiology of type 2 diabetes relies heavily on issues in the insulin pathway. Hypoglycemia, the hallmark of diabetes, occurs when the insulin pathway is faulty, either in the production of insulin or in the insulin resistance in cells. To understand this, let's have a look at the healthy insulin pathway. Body cells use glucose to produce energy for normal functioning. Glucose uptake into cells is regulated by the polypeptide hormone insulin. High blood glucose levels, among other chemical, hormonal, and neuronal factors, trigger insulin production in the beta cells of the pancreas. Once in the blood, insulin activity is monitored via a negative feedback system and promotes glucose uptake and storage in liver, skeletal muscle, and adipose tissue cells by interacting with insulin receptors in cell membranes. This causes lowering of blood glucose levels and facilitates energy production. However, in type 2 diabetes, this pathway is dysfunctional. Insulin resistance, the most common pathophysiological issue in type 2 diabetes, occurs when cells lose their ability to respond to insulin present in the blood. The pancreas produces more insulin to overcome this resistance, but due to beta cell dysfunction, insulin resistance prevails, resulting in little cellular glucose uptake. Effectively, the previously red pathways have become ineffective and glucose builds up in the blood, causing hypoglycemia. Future research is needed to fully understand the complexity of type 2 diabetes pathophysiology beyond this pathway. Areas of this may include diversity of the gut microbiome, subclinical inflammation, iron overload, or endothelial dysfunction. Now that we understand the general pathophysiology of type 2 diabetes, let's go see how it presents itself.
When I was diagnosed, for instance, I had blurry vision for a while. That's what I went to the doctor for. There are other things that came along with that, like being really hungry, being really thirsty all the time, needing to use the bathroom a lot, and needing a lot of sleep. My wounds also took a longer time to heal.
Sophie's symptoms are common among type 2 diabetics. Symptoms develop gradually due to prolonged hypoglycemia, with long pre-detection periods of up to 7 years not uncommon. 3 of the most prevalent symptoms are polyuria, polydipsia, and polyphagia, or excessive urination, thirst, and hunger, like Sophie mentioned. Polyuria is due to abundant blood glucose acting as a diuretic, causing excessive urine excretion. This results in cellular dehydration, as water is drawn into the blood to replace that which is excreted. Dehydration stimulates the hypothalamus and feelings of thirst, leading to polydipsia. Polyphagia occurs when cells lack nutrients because they cannot access or metabolize blood glucose due to insulin resistance, and so trigger hunger signals in the brain. Other symptoms of type 2 diabetes include slow wound healing, excessive tiredness, tingling in hands and feet, and blurred vision. Most of these symptoms can be credited to cellular dysfunction due to inadequate glucose uptake and metabolism. Thanks for watching!